is Marie Gadari. And, pardon? Why do I keep calling that? Marie. I'm sorry. I wasn't following my mnemonic very well. She is working on speech number 8 from the Confident Communicator, Get Comfortable with Visual Aids. And the title of her speech is How to Perform a Blood Pressure. And her speech is 6 to 8 minutes long. Please welcome Maria.
Hypertension.
Some people may agree with you on that. So the silent killer is also known as, Ms. Sue says, hypertension. Many of you are new here. I'm not familiar with some of the people here, but I've been a member here for almost a year. And those that don't know what I do, I am an instructor. I teach medical assistants, and I teach all clinical lab procedures. So what I'm going to present to you this evening is how to properly perform a blood pressure. First, does anyone know the difference between systolic and diastolic?
Yes.
Yes, I should. Some heart pumping versus resting.
So the systolic is a top number of a blood pressure. And this is what I tell my students, because my students have no idea what anything is, how to take a blood pressure, what systolic means, what diastolic means. So I go through this with my students. The systolic is how much pressure is going through the arteries of your wall, of the wall arteries, excuse me. The diastolic is the part that actually tells the doctor how relaxed your heart is. So if you have a diastolic, which is the bottom number, let's say 100, would you think that heart is relaxed?
No.
No, not at all. So I explain the different types of blood pressures with the students. And then I go over the different, the ranges, what's normal, what's pre-hypertensive, what's hypertensive, and what is extreme, where they need to be seen by a physician or go to the hospital because they're probably on the verge of having a heart attack. Now this here can vary from patient to patient depending on their history. Somebody can have a blood pressure of 90/60. Now, that is low. You may think, well, it's really low. However, if somebody is truly athletic and they work out a lot and they're very fit and they're just on the go constantly, but they're healthy, that is a normal blood pressure for them. Anything lower could be pretty dangerous. A blood pressure 120/90, sometimes that could be a little, yes, that's a little pre-hypertensive, or that can be normal. Again, it all depends on the history of the patient and what that doctor goes according to his guidelines. Every doctor has their own protocol on what they think is normal and what's not normal. So there are several steps that I teach my students before they have to really check how to perform a blood pressure. So the first thing they should always ask the patient, or when they're encountering the patient, I should say, always greet the patient. Hi, my name is Maria. I will be your medical assistant for today. Can you verify your name and your date of birth? You have them sit. make sure they see you, use hand sanitizer. It is key, because you want that patient to be very comfortable knowing that, okay, I have a nurse or a doctor using proper techniques to take care of me to make sure I'm not being exposed to other germs. When the patient is sitting, I tell them, remember these things, the mnemonics. Remember them. Ask them, have they been exercising? Ask them if they're smokers. If they're sitting, make sure that their legs are uncrossed. If they have a full bladder, make sure you ask them, do you need to use the restroom? If they do, ask them to please use the restroom to empty their bladder. These things, believe it or not, can vary the blood pressure anywhere from 10 to 40 points depending on what activity they've done, if they were stressed out at work, rushing to get to the appointment, if they had caffeine, because that can also cause high blood pressure or make it rise a little bit. These things are really important to be asking the patient. Like I mentioned before, many things can cause variances to hypertension or can cause a blood pressure to rise. Another thing that I always ask or tell the students, I should say, to make sure you're measuring the patient's arm to the proper cuff. You don't want to put a regular adult-sized cuff on a patient that's morbidly obese. Their arms are very big, that you're going to get an inaccurate reading. You don't want to put a regular cuff on a bigger arm or not morbidly obese. You just have to measure that cuff to the patient's arm as well. So the things that you're going to need are simple. You're going to need a stethoscope. You will need a sphygmomanometer. This here is a stethoscope. It's a dual. It's got both sides up here. I forgot what they're called, so don't ask me what it's called, I can't remember. But here is one type of blood pressure cuff. It's a sphygmomanometer. This is a regular adult-sized cuff. When you're placing this, when I tell them to place this on the patient, you have to make sure that they have no sleeves on. You roll up their sleeves and you palpate for their artery. And you palpate the artery, the brachial artery, using 2 fingers. Never use your thumb because your thumb has a pulse. So we start off with, you have your stethoscope, you have your blood pressure cuff. Another type of cuff that can be used, that I prefer, if you don't have this and you want to check it at home, is this. It's a Life Source cuff. You want to use one of these. The ones with the wrists aren't very accurate, in my opinion. So after you do that, you put the cuff onto the patient's arm. You ask them to sit upright, their feet are flat, and they're relaxed. Prepare the patient. I always tell the patient to relax. Do not talk. Some patients like to have a conversation with you. Believe it or not, talking can cause a blood pressure to vary between 5 and 10 points. Once you're ready, that cuff is on that patient, you put the stethoscope on that patient. I have a lot of students that like to put the stethoscope on the arm, in the middle. Now, is the artery in the middle? No. The artery, the brachial artery is on the side. So once that is done, you inflate the blood pressure cuff about 160, 180. You slowly release the air until you start hearing the very first thump. The first thump that you hear is your heart rate, and that is your systolic. You keep going down. You keep going down and releasing the air. The last heartbeat you hear is your diastolic. Once you hear that and you don't hear anything else, you release the air, and that is your blood pressure reading.